I'm just going to start with some of the numbers that we've got provincially. We're at 2,632 increase from yesterday, and what we've been noticing now really is the a trend to flatten it up a bit. So that's good news, and we're seeing that provincially when I look at the graphics across the board. So our deaths are at 5,614. So we're seeing a bit of a gradual decrease as compared to last week's trend. So that is, I think, good news. Although we still have very high levels, and these are mainly driven by Toronto, Peel, York, and so on. Ottawa had 162 cases added, and I'm just going to go over our some of our numbers here. Um, if we're looking basically here at the numbers we've added today and yesterday, actually, for the first time, we saw relatively lower numbers. Really, we added a total of 44. That includes 7 for Michael Sosny, 14 in Cornwall, 11 in SD&G, and 12 in Prescott-Russell. And if we compare that to what previous numbers, we were adding 30 per Cornwall, 35 at times. And so this, I think, bodes well for a slight decrease in our numbers moving forward. And if we look at our rolling average again, this is the indicator where we have high rates above red, obviously, very high reds. And you can see that we peaked probably around sometime around the first week of January, which coincides with Christmas and get-togethers and so on. And then we're seeing a downward trend in all virtually are. So the overall Eastern Ontario Health Unit downward trend is here now. We're basically at about 85 or so. Cornwall, that was quite high, has gone down. We had a bit of an uptick here. That was due to an outbreak that we had at one of the group homes, and then we're going downwards here, as you can see. So Cornwall now is lower, but all clearly we're still way above the red zone. We're really we are within gray zone territory, and so if we looking at the situation in our area, our although our positivity rate has gone down a bit. We're still quite high. We're still quite in the gray zone area. Our R naught is about 0.98, which is great. Last week was 1.5. We still have a lot of admissions in the hospital. We're at 23 with 6 in the ICU. We haven't had no increased deaths in our area, and we have 15 ongoing outbreaks. I'm saying this because I know that yesterday there was an announcement that the schools in Eastern Ontario Health Unit would remain closed and not reopen on the 25th. And the explanation for that is, again, this is the government that made that determination, but it was based on our numbers. When we were looking at our numbers, we are clearly in high transmission, high range of transmission in our area. And so if you couple that with the increased, what we saw positivity, an increased number of children getting infected over the holidays, the decision was made that schools in the Eastern Ontario Health Unit region, all schools, all 4 school boards that are in our region are to remain closed. I'm talking about the elementary schools to continue virtual schooling. This is going to be reevaluated, obviously. We don't have a date of opening, but I can tell you that as we go downwards, it bodes better for schools opening in that regard. Like I said, we're still high here, but I'm seeing trends downwards. Not a reason to be complacent. We need to continue with what we're doing. I think that right now we've been a week now with a shutdown, and I think that bodes well for decreasing numbers. But you could see virtually all our area, Prescott-Russell, SD&G, are still clearly in the red zone. And so again, the higher the community transmission rates, the higher the chances that it gets into the schools, and witness the fact that we're seeing outbreaks go in our homes, an increasing number of outbreaks in the long-term care, albeit 3 or so have positive residents, but the rest are staff that are positive. So I know we've had a lot of questions from parents about why are schools not opened, and that's the reason. It has to do with the actual numbers of where we are. But the good news is that we're going on a downward trend. The The other things that I wanted to talk about as well is basically, some of our outbreaks. I give you an update there. There's really not much changed with our long-term care facilities. We remain with Lancaster has not been changed. The other ones have not changed at all, and we're working with them as well. We have an outbreak at Riverview Manor, and we are working with a facility and City of Cornwall, EMS, our hospital to support them as well. So that brings me now to vaccines and vaccinations. And basically we have, just back to the schools, just before I go on to the vaccinations, at this point, we have one student at a school, a special ed school, special ed student, just one. They have special ed classes. That's one. That's all we have. We do have multiple children that are positive, obviously, that are school age, but are not in school at this point in time. So I want to now go over to talk about vaccines and give you a bit of an update. I've got some numbers here, and we will be posting the number of vaccines. As of yesterday, we had vaccinated we had administered over 1,500 doses, and they're going to be put on our website. As you know, there was a bit of a shortage. There is a shortage because of Pfizer. We knew that we were not going to be getting Pfizer vaccine next week. We have been told that we would start receiving Pfizer vaccine in February. And so we had already made plans because yesterday, as you know, or the day before, Pfizer announced that there will be no deliveries to Canada of Pfizer vaccination. And we don't have any news about Moderna. So at this point, we have vaccinated right now. Last week, we had vaccinated 6 homes and long-term care facilities. And up until now, as of today, we vaccinated 4 more, Centre d'accueil Roger-Séguin, St. Joseph Villa, Sandfield Place, and Hartwood in Cornwall. And we've got a couple of more to do this week. Our plan was to finish next week, pending delivery of the vaccination, but we don't have the vaccine in our hands. So we will pause, and we will now be concentrating on planning, resuming as soon as we get vaccine, likely the following week. We will still be within the deadline that was given to us for first dose in February. So that is an update of what we're trying to do. Yes, there is a bit of a shortage. We have been talking with the ministry. The ministry has given us some directives to now concentrate on residents and then move forward. So hopefully we'll get a bit of an update of when the vaccines will resume and so we can better plan. We have been constantly with meetings with the ministry, moving forward to ensure that we have the actual numbers that we need in place so we can do the appropriate planning. And that to me is the most important thing. We have it. And again, our priority is to vaccinate the most vulnerable ones, and those are in our long-term care facilities. And we are more than halfway there, and I'm quite happy about that. On a final note, I just wanted to say that the vaccination is here. I know that it will take a bit of time for the vaccine to be rolled out to everybody. It's a bit of a sort of bottleneck now, a bit of limited supply, but it will soon. I know that we will be getting vaccine over the next couple of weeks, and we know that we're getting a lot of vaccine certainly into the end of February into March. And so we are planning a progressive rollout. I think I've explained the different phases. Right now, our phase is to do the vulnerable healthcare, and then we will work into essential workers, elderly, and so on. So as we get more closer to those, as we get more target dates, we are going to be announcing them and sharing them with the media and the public. It's important to note that we do have a team working on it. We actually submitted our plan yesterday to the ministry that is very comprehensive, that looks at the different phases and how we're going to roll it out. Donc, bonjour tout le monde. Je vais commencer avec nos chiffres. En Ontario, on a augmenté de 2632 cas. En effet, ça, c'est des bonnes nouvelles relativement, parce qu'on était toujours à la 3000, 3600. Là, on voit qu'on diminue. On est à peu près à 2600 aujourd'hui. La moyenne hebdomadaire a diminué depuis la semaine passée. Donc, ça, c'est des bonnes nouvelles aussi. On a augmenté nos décès à 46. Toujours, la plupart des cas sont autour de Toronto. Hier, Ottawa a ajouté 162 cas aussi. Donc, je vais partager mon écran encore pour vous démontrer nos statistiques. On va aller ici. Donc, on voit qu'actuellement, on a 544 de cas actifs avec 2297 cas en total. On a 23 patientes hospitalisées et 6 patientes aux soins intensifs. Les décès ne sont pas changés depuis la dernière fois. On a toujours 15 flambées avec 46 résolus. De façon importante, j'aimerais juste souligner un petit peu qu'on on a ajouté 44 depuis hier. 7 à Aquasasni, 14 à Cornwall, 11 à SDNG et 12 à Prescott-Russell. Si on compare les semaines passées, on ajoutait une trentaine des fois à Cornwall. Donc, on voit une tendance de diminution qui est des bonnes nouvelles pour nous. Si on voit au niveau de la moyenne mobile, qu'est-ce qu'on voit ici? C'est que nous voyons en effet que vous voyez toujours la ligne rouge. Si on est plus haut que la ligne rouge, on est dans une phase de hausse transmission de COVID dans notre région. Et évidemment, vous voyez, on est vraiment beaucoup plus élevé la première semaine de janvier. Ceci, à mon avis, représente les tendances qu'on a vues autour de Noël, pendant les fêtes. Là, on voit là, maintenant dans toute notre région, incluant Cornwall, qui est vraiment beaucoup plus élevé que les autres, qu'on voit une diminution progressive. On le voit nettement que ça va dans une bonne direction. On peut dire la même chose à la moyenne. Ça, c'est l'orange ici. Ça, c'est la moyenne de notre bureau de santé. SDNG est en gris aussi et Prescott-Russell est ici aussi. Mais il faut souligner que même tous les chiffres ici sont dans la zone rouge, bien sûr, proche dans la zone orange, gris. Il faut dire aussi que notre taux de positivité est toujours haut, en effet, mais c'est diminué. La semaine avant, c'était 7%. La semaine passée, c'était 5%. Là, on est rendu à 3,5%. Donc, on voit une diminution, mais quand même, ça nous met plus dans la zone rouge et gris. Le taux de reproduction était 1,5 la semaine passée. Là, cette semaine, c'est 0,98. Ça, c'est de bonnes nouvelles. Ça diminue. Mais on a encore des flambées augmentant, des éclosions augmentant, et nous avons aussi beaucoup de patientes hospitalisées. Je dis ça parce que j'aimerais aborder les questions qu'on a eues, parce qu'il faut être clair que les écoles dans notre région, soit dans les 4 conseils scolaires dans notre région, ne vont pas ouvrir la semaine prochaine. C'était une décision qui a été prise par le gouvernement suite à l'inspection suite à vérification de nos chiffres que je viens de vous démontrer que malgré qu'on voit une amélioration, on a encore un taux haut de transmission dans la communauté. Donc, on sait que ce n'est pas une raison, c'est pas une question que les écoles ne sont pas sécures, c'est une question que nous avons beaucoup. Quand on a une transmission haute comme ça, c'est facile que quelqu'un peut rentrer à l'école, va développer des symptômes à l'école ou va infecter les autres personnes ou va exposer les autres personnes. Et ceci va commencer à vraiment déranger les opérations, et fermer les classes, etc. Et ici, on voit ça beaucoup dans les écoles. Ça va causer beaucoup de problèmes aussi. En effet, mais qu'est-ce qu'on voit maintenant? C'est pour ça que la décision a été prise. Il faut dire aussi qu'on sait que le pourcentage des enfants qui vont à l'école, on commence à avoir beaucoup plus de cas pendant les fêtes et la première semaine de janvier. Et aussi, on voit le taux de positivité chez les enfants est plus haut que la moyenne aussi, surtout pendant les fêtes et la première semaine de janvier. Donc, pour toutes ces raisons, le gouvernement a décidé que les écoles dans notre région, soit SDNG, Prescott-Russell et Cornwall, resteront fermés, ne vont pas rouvrir le 25. Les autres bureaux de santé autour de nous, qui ne sont pas vraiment dans notre situation, vont ouvrir soit Leeds, Grenville, mais pas Ottawa. Ottawa est en zone rouge aussi au niveau des chiffres. Donc, c'est pour ça que j'aimerais souligner que les écoles n'ouvrent pas. Par contre, on a des bonnes nouvelles. Donc, si on continue avec ce trajet, on va être capable de les ouvrir, mais ceci, on va en discuter avec le ministère pour voir les dates. Je sais que les autres écoles qui sont en zone gris ne vont pas ouvrir avant février. Donc, c'est une chose à discuter et à surveiller, mais j'aimerais juste clarifier que le point est qu'actuellement, on est encore presque dans une zone gris avec un hausse niveau de transmission dans notre région. J'aimerais dire aussi qu'on a juste un cas dans une école qui est positif, dans une école qui donne les cours aux étudiants spéciaux, mais nous avons plusieurs cas des enfants positifs, bien sûr, qui ne vont pas à l'école, mais ils sont l'âge scolaire. Au niveau je vais juste fermer ici. Donc, au niveau des autres flambées, on n'a pas grand changement au niveau des flambées, sauf que la maison de Lancaster semble stable. On n'a pas d'autres décès, heureusement, mais quand même, tragiquement. On a une flambée. Presque tous nos flambées n'ont pas des résidents affectés, sauf quelques-unes. Nous avons une occlusion à Cornwall, à Renfrew Manor, qui est une maison de groupe. Et nous avons plusieurs cas positifs et nous assistons avec l'aide de l'hôpital, l'aide paramédique, l'aide de Croix-Rouge aussi, pour aider, ou des autres agences, nos airlifts notamment, pour aller aider cet établissement. Donc, je vais passer au niveau des vaccins. Comme on a déjà dit, nous avons déjà les vaccins dans notre région et je peux vous dire que jusqu'à date, jusqu'à aujourd'hui, nous avons vacciné presque la moitié. On a vacciné depuis cette semaine, on a vacciné 3 maisons. On a vacciné Centre d'accueil Roger-Séguin. Hier, on a vacciné Saint Joseph's à Cornwall et aujourd'hui, on a fini avec Sandfield Place et Hartward à Cornwall. Il nous reste 5 à faire. On va faire quelques-unes demain et jusqu'à temps qu'on n'a plus de vaccins. Jusqu'à hier, on avait donné plus que 1500 vaccins, mais on n'a pas compté celles-là qu'on a données aujourd'hui. On met ça sur nos sites web avec une mise à jour, avec une liste des maisons de longue durée qui ont reçu le vaccin. On met ça en mise à jour sur nos sites web. Très contente qu'on a vacciné, qu'il nous reste moins que à peu près un tiers ou moins des maisons de longue durée à faire dans notre région. C'est des bonnes nouvelles pour nous. Par contre, nous avons été, la semaine passée, on se fait dire qu'on n'aura pas de vaccin le 25. On ne recevrait pas le vaccin le 25. Par contre, on était prêt pour ça. Mais si on recevait le 25, on aurait fini la semaine prochaine. Malheureusement, à cause d'arrêt de production de Pfizer, et vous avez bien entendu qu'on n'aura pas de vaccin en Canada la semaine prochaine, on ne va pas vacciner la semaine prochaine, à moins qu'on reçoive avant. Mais donc, on va finir la première semaine de février. Ceux qui nous mettent en avance de l'échéance qu'on avait été émise le 15 février. Donc, on va continuer à les vacciner. On concentre le plus possible au niveau des résidents parce que ça, c'est les personnes qui sont, à mon avis, les plus vulnérables. Donc, ça, c'est des bonnes nouvelles. Vraiment, on attend On attend avec beaucoup d'impatience de recevoir plus parce que nous, on est prêts de le faire. So I'm just going to go to some of the questions right now. Je vais déborder des questions. I have a question here from Nelson. Is the EOHU going to follow the example of North Bay unit closing snowmobile trays? I do not understand this question. We have no intention of closing snowmobile trails. People can snowmobile. It's an allowed activity. The only thing that would be closed is indoor huts and those type of things, and limit the number of people around a fireplace or something like that. But moving forward, we don't have any indication. There's no indication in the regulation, and there's no desire on our behalf to forbid or limit snowmobiling. I have another one about schools. I've answered that. There's a question about a construction project in Nation Rise. Nelson, I'm not sure. I have to look at the regulations. There are specific regulations as to what can continue, what cannot. And I don't know where that fits. We can look at that. J'ai une question de FM 104.7 au niveau des écoles. J'ai été clair. Je pense que j'ai clarifié la question qu'on va être fermé. Could you confirm there's been an increase in opioid-related overdoses in Cornwall since the beginning of the pandemic? Yes, I can confirm it. We're actually looking at the numbers now, and it seems that we've had a much higher percentage of that. And I will be getting the data that's just being assembled right now, but we do have the data for that, and I will share that at the next one. So will there be a slowdown of vaccinations as a result of, yes, there will be. I think I've explained that. I'm hoping that we can get maybe Moderna, but we have not received any other Moderna except what we had sent to Akwesasne. We haven't received anything since. And talking about a workplace-related outbreak, yes, there was one at a car dealership, but there were no direct public risks. And that's it for now. I'll take questions, Jenna.
Thank you, Dr. Paul. Merci. Our first question comes from Bill Kingston, Cornwall Newswatch. Please go ahead.
Hi, Dr. Paul.
Hi, Bill.
I wanted to ask you, Dr. Suzanne Rutherford, who runs the Qu'il Assessment Center, has raised concerns about the positivity rate of teens and tweens. Since schools were shut down in their area, positivity of 9 to 13-year-olds went from 5.5% to 17%. Teens went from 6 to 15%. And she said that this shows with schools being closed that parents have been making choices that have increased the exposure rate to those teens and tweens. They have since opening the schools here, but we are not. Are you seeing a similar situation here? And to drill down on the public health indicators that are keeping us closed, is that part of the problem?
Well, you see, yeah, there's a double-edged sword here. So one is, if you keep them home, you can't kind of. But yes, there is, as a matter of fact, provincially and locally as well, there's high rates. The positivity rate was actually, on the average in Ontario, 22% for 11 to 13-year-olds. And it was about 18% for 4 to 11. So yes, and we've seen an uptick. I have a graph here that I had seen before, a real big increase in that age group. So that says, yes, the kids are getting together and not being supervised. On the other hand, if we have high rates in that area, we also have high rates among the public working, and even if we bring them back to school, before seeing a decrease, and that's where we are now, before seeing a decrease, we will get kids incubating, going in, all of a sudden being fine, exposing others, not unknowingly, teachers as well. So that's the rationale. I'll be honest with you, Bill, I was a bit on the fence. Like last week, I would have said, you know what? I'm seeing the numbers high. Those numbers we were seeing, I don't think it's a good idea because the more you have it outside, it's going to go inside, regardless of what you do. But this week, the numbers are going down. So I'm encouraged that we'll be able to get into that level closer to the 40, if not below, overall, those indicators. And they're going in the right direction. But still, our percent positivity is in the red or gray zone. We're borderline with the reproductive numbers, and our positivity and our rolling average, you see, is quite high. As a matter of fact, I was looking at the numbers before, Bill, and I was always looking and comparing ourselves like per 100,000 between us, just caseload between us and Ottawa. And I remember we were really lower than Ottawa. Like Ottawa was like 600-700 per 100,000, and we were like 100, 200. Now I compared it. Ottawa is at 1199, and we're at 1066. We've really gone up in terms of the numbers. So I that's why it's a double-edged sword. I understand that kids are safer, well, not safer, but have more precautions because they've got masking and you got all these things at school. But on the other hand, it will inevitably get there. We're doing the same. We have the same precautions in long-term care. It's still getting in. People are bringing it in asymptomatically. So that's why I was on the fence on this. It wasn't my decision. It was based on numbers, but I can see why the decision was made.
And like you said, a lot of these household clusters you've seen where these cases are going with these teens and tweens. Are you seeing any cases where there are teens, just going over to a friend's house?
Yeah.
Infecting household to household.
And that's what we're seeing. Or they're going out elsewhere together and then coming back and infecting household. That's what we're seeing. So if you look at that pie chart that I shared last week, and we're going to put online soon, you can actually see that there's like a quarter of friend and affiliate contact, and there's a quarter workplace. And then they go back and they multiply it. That's what happens.
And just a quick follow-up, on Monday, South Glengarry Councillor Stephanie Jaworski asked you about the 5 people at Lancaster that tested negative. You said you were going to take that back to your staff.
And we're likely going to go and we're talking with my staff, and I think we're going to reach out to them. Yes.
Okay, perfect. Thank you.
Okay, you're welcome.
Next question comes from Philip Blanchard, the leader. Please go ahead.
Hi, Dr. Paul. I got 2 questions, and it's along the stream of what Bill was asking about. So, in your opinion, with keeping the EOHU for remote learning right now, do you think that was the right call to make yesterday?
You know what? I thought if it was last week, I would have said it was the right call. If it was yesterday, I still would. I think it was the right call given our numbers. Do we have an ability to open them next week? I'm not sure. I got to speak with the ministry, but I think it was. I'm looking at the numbers. I'm looking at the progression of going downwards. But despite the fact that we're going downwards, we're still pretty high in the red zone. And I was looking at a map that showed red. It was the eastern tip was red and the southwestern tip was red. So to me, I think it was the right decision. Again. I'm encouraged though that we are going in the right direction, but we're still not low enough because all of our indicators, I was looking at them, put us really in gray rather than red.
Okay, and to follow up on that, do you know what the exact benchmark or the metrics are to determine whether or not a health unit can reopen its schools? And do you think we'll reach that level by or before the February 10th expiration of the stay-at-home order?
Well, the level really is we'd have to clearly be beyond red into orange. Okay, that's what it would be. So I would like to be below 40 for that, and look at my other numbers. Clearly in the red or orange zone. I'd like to do that, and I am yes. And if the trends continue, we're going to be there certainly by the time that they reevaluate the other ones by February 10th. So I think that would be the worst case scenario. Again, I don't know what the ministry wants to do. If they want to do it week at a time or wait till then, but I think that the chances are very good that we will be opening the schools certainly by then.
Okay, and one other question. One of the issues that caused a lot of the propagation of the virus after Christmas and that was, multiple people living in the same home. The virus gets in, next thing you know, it goes everywhere. Ontario announced today opening of isolation centers in more urban areas. Are there any plans for isolation centers in the EOHU?
We have that as a backup plan. We have been discussing that, and if we do at an ad hoc basis need to create, we will. If we see a situation where it's impossible and there's a lot of people, that is not out of the question, and there is funding for that as well.
Okay, thank you.
You're welcome.
Next question comes from Nation Valley News. Please go ahead.
Hi, Doctor.
Hi.
Rapid testing. Are you disappointed with the amount of rapid testing here in 2021 that we actually have? It should have been ubiquitous. It should be a key plank in the fight against the virus in addition to vaccination. So much could be opened if we had rapid tests at theaters and stores and schools. Instead, it's group punishment, which is basically the approach that has to be taken. Tell us a little bit about rapid testing, what's happening in the area here.
Okay. Let's divide it into two. Rapid testing, PCR, which is the ID now, which is a little toaster-looking object that you do a nasopharyngeal swab and you put it in, and in about 10 minutes you get the result. That is almost like a mini laboratory. We have just been sent 3 or 4 to our health unit, and we will have them ready to go and deploy to schools and so on. It's a matter of calibrating them and getting some training. The other one that is more what you're talking about more is the PanBio, which is the rapid test that will screen people. You do it and you get it right away. That is not as sensitive as about 80% sensitivity. There are multiple pilot projects that I looked at it, trying to see how sensitive it is. Like, for example, now trying to adapt that for doing it regularly at long-term care facilities, all the staff, retirement home staff, those type of things. It won't be good for outbreaks. Outbreaks, we'd be using the other one, the laboratory one, but for regular use. Here's where the rate limiting factor was. Okay, that now has been removed. You had to, in order to increase the sensitivity, you'd have to do the test at least 3 times a week, if not daily. And up until very, very recently, these tests were only nasopharyngeal. In other words, you'd have to put it in the nose and into the back of the throat, and you need somebody specialized to do it. Very recently, it's been changed now, and we can do a nasal swab. So that's a game changer. So I believe that now that we have that and have some sense of reliability, knowing that you need to do it serially to pick up cases, that I think it's going to be used more and more in the context of workplaces and those type of things. How sensitive it is as a one-off for just once going before in the movie theater or whatever, I'm not sure, but I can tell you that I would not use it for outbreak management. Let's say we had a school or we had a long-term care facility and we wanted to go in, test about 30 or 40 people. I would bring the machine in. And that machine is not available to everybody. Obviously, it's costly, but that PanBio, now that you can do a nasal swab, I think is a game changer.
Just to follow up, it's not really related, but what are the odds that the people who have received their first shot of the Pfizer vaccine at the nursing homes will get it in 21 days?
Not very likely. I think that we have to go closer to the 27, 28 day, from what I heard yesterday. That may change, but that's something that we were told yesterday.
Thank you, Doctor.
No problem.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux.
Oui, bonjour, Francis Legault, journal régional d'Augsburg. On vient de poser quelque chose, une question semblable, mais je veux aller plus loin. Lorsqu'on dit que justement, on va manquer de vaccins de chez Pfizer pour la première dose, est-ce que pour la deuxième dose, est-ce qu'il y aurait des contre-indications d'administrer le vaccin de Moderna à la place de mettre le vaccin de Pfizer? Ça,
c'est une bonne question. Malheureusement, on ne peut pas mêler les deux. En effet, si on commence avec Moderna, il fallait donner les 2 doses de Moderna. Ça ne va pas compter comme une deuxième dose de Pfizer, malheureusement. On ne peut pas les changer.
Est-ce parce que les deux sont quand même de composition assez semblable? Est-ce que c'est parce que c'est les molécules qui sont dans le vaccin qui sont différentes?
Probablement oui, parce qu'il n'y a pas des études qui ont démontré les 2 différents vaccins à la fois. Donc, on n'a pas de données pour supporter. Donc, ce n'est pas indiqué. En effet, c'est contre-indiqué. Ce n'est pas permis de mêler les doses comme ça, au moment qu'on parle.
Mais ça pourrait changer peut-être.
Ça pourrait changer, mais je peux vous dire aussi que on a plusieurs vaccins et des fois, ça change des compagnies et il y en a certains vaccins qu'on peut changer. On peut donner une d'une compagnie comme première dose et une autre pour l'autre, mais ça dépend du vaccin. Et il y en a des autres vaccins qu'on ne peut pas le faire parce qu'il y a des études qui ont démontré qu'ils ne sont pas efficaces comme ça. Donc, ça dépend. Donc, c'est tellement nouveau que pour le moment, on ne peut pas le mêler.
Parfait, merci.
Pas de problème.
Other questions by phone. D'autres questions par téléphone. We do have one more in the chat box, Dr. Paul. Was there a case at Tim Hortons in Winchester from Nation Valley News?
Yes, there was a workplace case, and there was no public exposure.
Those are all the questions for today, Dr. Paul.
Thank you. Merci.